855, which obviously the senator authored, and he's been so kind to come join us and speak to us about it. And so we thank you so much for that. Thank you for being here.
Absolutely. Thank you for having me.
Of course. To everyone else that's here, thank you all for being here as well. We're going to get started now since the senator is here and most of you have arrived. And for those of you who arrived late, we'll send you a recording as well. But first, let me introduce myself. My name is Ali Beheshti. I'm the CEO of Zealie. Zealie is a medical billing company that specializes in substance use disorder and other behavioral health disorders. I myself, prior to starting Zealie, was a CEO of a treatment facility up until about 4 years ago when I started this company. This company is typically a very technology-enabled company. We have software developers. Obviously, we have subject matter experts and attorneys and MBAs here as well. But Zealie is unique in the fact that we built out the platform ourselves for substance use disorder and behavioral health disorders. I myself, education-wise, hold a law degree, like the senator as well. That's about all I'm going to talk about me, because let's face it, you're not here to hear from me. You're here to hear from him. So Senator Scott Wiener is a California state senator, as you know. He represents the 11th District of California. This encompasses all of San Francisco and a lot of the surrounding areas, so a large area. He's authored quite a few bills. I tried to read a few. There's 42 he's authored, which is, if you know anything about the legislature, that is a very high number, including obviously SB 855. He chairs the Senate Housing Committee, but he's also a member of numerous other committees throughout the Senate. He also holds a law degree. He attended Harvard Law School, and prior to entering the legislature, you actually practiced law. And there's so many other things. I would say just reading your legislative history, I would say the synopsis is he stands up for people. That would be the short of it. If you read, I recommend people reading it. The people he's representing, he's standing up for a lot of people, including what we care about, of course, here in this discussion, patients that want to have increased access to healthcare. So that's one of those groups. So once again, thank you so much for being here. I'm sure I missed so many things because your bio is very impressive. If you have anything else you'd like to say and introduce yourself, feel free to do so.
Sure, absolutely. Thank you so much for having me, and hi to everyone who's attending today. It's a real honor to be here. And you know, when you talk about mental health and addiction, it's just something we've overlooked as a society for way too long. It's been, you know, traditionally viewed as some sort of personality flaw or moral failure by the individual, and with this attitude of just, you know, just get it together, shake yourself out of it, you know, or just say no, the Nancy Reagan, you know, drug slogan. And yes, of course, people, you know, personal strength matters, but we know that, you know, you would never say to someone who has a broken arm, who has cancer, just shake yourself out of it. You know, these are health conditions that we know are not just not a personality problem. It is because it's a disease of the brain, and the brain, last I checked, is a physical organ, the same as the heart or your small intestine or your liver. And so we have you know, the brain in some ways is, you know, certainly a very important organ, but we have said that diseases of the brain are somehow different, and we just can let them go. And as you know better than I do, these disorders can be just absolutely debilitating, preventing people from work, people losing their jobs, their families, and people dying. And it can lead to other physical ailments too. And so we have really been trying to turn this around in the legislature, and mental health parity, of course, is part of that, and really starting to treat addiction as a health problem, not a criminal problem. and so on and so forth. So it's work that I'm passionate about, and we're going to continue to do that work to move us in the right direction. So thank you.
Thank you for that. So you actually kind of got into our first question,
Yeah.
And that is, what inspired you and what led you to draft this legislation? Obviously, I'm sure there's something that led
Yeah.
to it.
Well, I mean, I've done some work over time around mental health and addiction, and I authored legislation to expand resources for mental health needs of young people, because we know that that mental health issues overwhelmingly manifest during teenage and college age years, and yet we don't do much for these kids. And we know that if you nip it in the bud and you intervene quickly before someone experiences a break, you are much more likely to be successful in getting that person healthy and back on track. And we've also done work around addiction, whether it's our legislation to legalize safe injection sites, which we're taking another run at this year, and other approaches. It's just something I'm very passionate about. And, in my own community in San Francisco, I mean, mental health and addiction are problems everywhere. But in San Francisco, because we are a very concentrated city, everything is in the open. And so we see untreated mental health and addiction issues playing out on our streets every day. And San Francisco is not unique, but you see it more there because we're all living on top of each other, and it's very expensive, so more people are on the street, and it's just a tragedy. And so people in my community see, even if you don't have a family member who's impacted, they see real time. They see people in their community, homeless people on our streets, they see them day by day deteriorating, and then one day they're gone. And then, of course, people who are struggling with it in their family. So in San Francisco, this is something that people care about a lot. I care about it a lot, and it's really motivated me to take a leadership role. I was very lucky that Senator Jim Bell, my former colleague, I hate to say former, I wish he were, still in the Senate, although he has a great successor. But he really mentored me a lot on mental health policy. He was a real leader his entire time in the Senate, and founded the Mental Health Caucus. And so I learned a lot from him.
Oh, okay. I did not know that. That's interesting. So you've had quite the legislative history in regards to this. Okay. So for those people joining us that may not know too much about it, obviously, legislation can be dense. For those of us who went to law school, it's a little bit easier to read. But for everybody else, if you could just give a brief summary of the legislation and its intent.
Yeah, so Senate Bill 855, and it came to me, actually. It's something I'd known about, the issue about mental health parity, and that there's federal law and state law, and it's not strong enough, and insurance companies often don't follow it, and you have to sort of drag them in kicking and screaming. And so a coalition came to me, knowing that I had done some work in mental health. The Kennedy Forum, Patrick Kennedy, and the Steinberg Institute, Darrell Steinberg, the former president of the Senate, now the mayor of Sacramento, with a passion for mental health. And so these two groups came to us and said, we want to really shore up and strengthen California's mental health parity law, and try to set an example for both the federal government and for the other states. It's going to be a huge fight. Do you want to do it? And I, for anyone who knows me, I'm one of those people who I'm like, sometimes, a righteous fight is like, it's like a dog whistle for me. I'm like right there. And so I said yes, and we sort of worked it through, and it was very a roller coaster kind of bill. There are a lot of people with a lot of opinions in the healthcare space, but we were able to bring the whole coalition together in the end, and ultimately overcome intense insurance company opposition. And it was one of our strongest supporters, most eloquent supporters, is the Republican leader in the Assembly, who was just, so we had really nice cross-section of support. And what the bill does is it basically, it closes a lot of the loopholes. In California, as you know, passed a mental health parity law in, I think, the late 90s. And then there was a federal law, and the Affordable Care Act helped, but it's really like, it's about state law. And that parity law was very important, but it was very limited. And it only applied to a small number of mental health diagnoses. It did not apply to substance use disorder at all. It didn't cover a lot of different kinds of anxiety disorders and PTSD disorders and eating disorders. And it just left an enormous amount out. And there were also some other loopholes that the insurance industry would use. And so we basically created a new standard that anytime a physician determines that a particular treatment for a mental health disorder or substance use disorder is, quote, medically necessary, the insurance company must cover it. And so we broadened it out to all mental health and substance use disorder diagnoses. And we gave more power to physicians to be able to determine what is medically necessary. So that's the basic gist of the bill.
Yeah, thank you. That was interesting knowing this is one of those few not partisan issues, right? I was happy to hear that is taking place in California and honestly nationally.
And to be clear, we most Republicans oppose the bill. I mean, this is a law where I believe pretty much, I think every Democrat in the legislature or just about voted for it, and or not by 95%. And there were a few Republicans who supported it, but most did not. But even having a few Republicans is better than when we have this total partisan split.
Direct partisan, right down the party line. So that's good. I was unaware of that. And that also the Kennedy Forum, that's obviously one group that's very passionate about this topic. So I'm happy to hear they were involved in the process as well. So what do you hope the effect will be? I mean, there's going to be short-term effects and there'll be some long-term effects, but on the mental health and substance use disorder treatment in California, and probably, from an access point to that treatment, I think would be the way we want to discuss it.
Yeah, I mean, I think, we're going to have to enforce it, right? We're going to, because we will have situations where a physician will prescribe something and the insurance company says no. And, that happens even now with physical health where they inappropriately deny care or there's a dispute. And so we're going to have to really monitor. Physicians are going to, and I think physicians will be, or healthcare professionals will be, have a big incentive to be educated about this, and will probably there will, I think, especially at the beginning, be some fights, and so there are going to need to be some appeals. We're going to need the Department of Managed Healthcare and Department of Insurance to be aggressive in enforcing the law. We initially had a private right of action in the bill, so someone could sue if they were denied. That was removed. Those are really hard to pass through the legislature. So we're really going to need to rely on our state agencies to enforce it. We think we have a pretty robust network of providers who will tell us if there are problems. I know my office is going to monitor it with the agencies to make sure that it's being implemented correctly, because sometimes an agency can start making bad interpretations to narrow the scope of the bill. We want to make sure. And I would say to everyone on the Zoom, if there are problems where you think that insurance companies are inappropriately denying care, then we want to know about it.
Yeah, I have a feeling early on you might get bombarded now that you mentioned they could reach out to you.
Yeah, and I saw there was a question in the chat box about when it goes into effect. It goes into effect January 1st. That's how it works in California. That typically when we pass a law, it goes into effect the following January 1st. So January.
Excellent. Thank you. So you actually kind of touched on this, and knowing that the Kennedy Forum's involved and they came to you, I have a feeling the answer to this is clearly yes, but maybe you can go into a bit more detail. Do you view this legislation, and it sounds like there might be some follow-up legislation to this, which we'll cover later, because I liked hearing about that private right to action. I know that's a tough one, but that's interesting to know that that was originally in there. So do you see this as a model where potentially the rest of the nation starts taking note of what's going on here and the benefit it has?
Yes. This is puts California #1 in terms of the strength of our mental health parity law. So we are hoping, and I'm sure the Kennedy Forum will be proactive in trying to get similar bills introduced in other states. After the bill was signed, Congresswoman Katie Porter reached out to us because she's done some work at the federal level, and she is interested in trying to take this federal. And so Congresswoman Porter and I co-authored an opinion piece in the San Francisco Chronicle about it. So we're hoping it sparks some energy around the country.
That's funny. I have a feeling a lot of the people at this are in Katie Porter's district. I'm sitting in it actually right now. So I'm not surprised to hear she's involved on the national. That's great though that you authored that opinion piece, because I have a feeling people will be reaching out to you, because there's going to be a lot to learn, because we're going to learn a lot, and I think the other states will have that kind of advantage of learning from what we learn, right?
Yeah.
That's good to hear. Let's go to the next question here. So I think you actually touched base on this when you use the term physicians, but a lot of the people here are not also physicians, they're therapists and they're owners of treatment facilities. And what they can do, what recourse they have regarding when they feel that a carrier may have violated the provisions of SB8.
When I said physician, I really just mean whoever is able to prescribe treatment for mental health addiction care, physician or otherwise. I think if someone, I think it's similar to if someone is when someone prescribes physical treatment, prescribes a medication and the insurance company says no. There are appeals that you can take within the insurance company, and then you can go to, it's depending on the type of plan, either the Department of Managed Healthcare or the Department of Insurance, and file a complaint. Now, there are some insurance plans that are regulated exclusively under federal law, and so that creates more challenges. But for anything that's, for example, Cover California or other kinds of state regulated plans, the law will cover it.
Okay. Speaking of the providers, I assume patients have a similar mechanism.
Well, the patient, so what would normally happen, and I know this because one time my physician prescribed medication for me, the insurance company wanted to put me on a awful alternative medication, and so it was brewing as a fight. And so what would happen is the physician would first start escalating it because there are physicians on staff, or a physician or provider. There are providers on staff in the insurance company. And in my case, that's how it worked out. My physician got someone senior enough who got it. Had that failed, I would have filed an appeal as the policy holder, an appeal, and that would have been, and then after that, you can then go to, depending on the insurance policy, either the Department of Managed Healthcare or the Department of Insurance to file a complaint. Already, Insurance Commissioner Ricardo Lara has made clear, he actually issued guidance already to the health plans to basically say, you better follow this law because we're going to enforce it. And so and I know that Commissioner Ricardo is very committed to that enforcement. We're hoping that the Department of Managed Healthcare is equally committed. That's
excellent to hear. Yeah. In my personal experience, I've noticed it helps, especially when both sides get involved, both the patient and the provider. If they come at it at both directions, I've seen significant results. So it's good to hear that they're taking it seriously, because I know there's going to be pushback, as you know, right? From the
And
carrier.
interpretation issues, right? The
Yes.
insurance industry will do everything they can to narrowly,
Mhm.
and so it will certainly be a little rocky for the
Mhm.
first period of time, but it's really important for providers and patients to exercise their rights and to challenge some of these denials.
Mhm.
And again, if there's particularly abusive behavior happening with the health plans, we want to know about it. I mean, I do think that a lot of the health plans will just comply. And there might be some disputes around the edges. I think
Mhm.
a lot of the health plans are going to be fine. Some will, there could be some bad actor kind of situations, but I don't think that'll be the majority. But I think even more likely, you might have just within the insurance company, you could have just the people who are involved in making the decisions. There needs to be an education
Sure.
process, right? That it's changing. And so you could have some just mistakes that are made at the beginning, which is why you really need to escalate and challenge.
Yeah, I would agree. Regarding interpretation, I've
Yeah.
frequently had to speak to payers about their interpretations of certain legislation, can obviously be favorable to themselves. So,
Yeah.
but I have a feeling once that's ironed out, it'll be significantly easier to follow those interpretations. Um, So this was a question that actually came to us from before someone sent me a previous question. What can the people that a lot of these people on this are treatment providers? They're either the medical directors, so they are physicians, or they're the owners of behavioral health facilities, and they wanted to know what can they do to assist the state. Is there, um, eh, anything you would recommend? It sounds like you kind of covered in the last question, but
Well, I think that particularly at both Department of Insurance and particularly at the Department of Managed Healthcare, it's important for the different associations
Mhm.
to engage in whatever implementation guidance or regulations they're issuing. And
Mhm.
so whether, it's the Psychiatrist Association or the Psychologist Association or the Therapist Association or
Mhm.
your associate, like just, the people who own the treatment centers,
Mhm.
to be engaged in that process and do it now.
Mhm.
There are some groups that are already, like for example, the National Union of Healthcare Workers, NUHW, which
Uh-huh.
represents a lot of mental health professionals, not physicians,
Uh-huh.
but they're non. Actually, they may represent some physicians too, but therapists and others at Kaiser and some other facilities. They were very involved in legislation, and they're really watching the regulatory process to make sure it doesn't get messed up. So I would encourage the other associations to do the same.
Okay. Well, I think a lot of people just heard you because I know for myself and a lot of the people on this, we are members of some of those associations. And I think we need to come together and step up and help with this because, um, you know, we're the ones on the front lines seeing what's going
Yeah.
on and can actually um, inform what's going on the street, So let's see. And you touched base on this, but maybe you can go into a bit more details. Are you either planning additional amendments to this in the next legislative session, or are you waiting, or what's the plan?
Well, most big bills at some point require cleanup or technical clarification, or there are just mistakes that were made. We're unaware of any yet.
No.
And if some arise, then sometimes you can, if it's really technical, you can put it into an omnibus bill or even the budget and just get it cleaned up. Sometimes you have to do more substantive changes, and then it could be me or it could be a different legislator can introduce legislation. I'm unaware of any for next year. I was a pretty well vetted bill, so a pretty well structured bill. So we're not planning anything around this. We are doing a bunch of work next year on mental health and addiction policy. So we're going to have a pretty full agenda on these issues.
Okay, well that's actually the next question is, do you have any other mental health and substance abuse legislation planned for the future?
Yeah. So one thing we're working on is right now there are certain requirements under California law for getting a timely appointment when you have a mental health or addiction issue. But the problem is that after the first appointment, there's sometimes big delays to getting the second appointment and third appointment. So we're going to be doing some work there to make sure that the follow-up appointments are also required to be timely. We just want to make sure people can really access care. I've already announced we are reintroduced legislation that Jerry Brown vetoed in 2018 to legalize to allow at San Francisco, Oakland, and LA to pilot safe consumption sites or overdose prevention programs, as we call them, where people who are using can go into a safe space that's clean and healthy that has healthcare supervision, where they'll get a clean needle. They can get their drugs tested to make sure that it's not fentanyl, for example, and then also get offered services and hopefully go into recovery. These programs have been in place for a while in Europe, Canada, and Australia. They've been very successful, and a majority of people, infections go down, overdose deaths go down, with a huge spike in overdose deaths. And a majority of people eventually go into recovery. We want to take away the state prohibition, allow them to be piloted, and we think it'll really help save lives. We are doing some work. We're going to reintroduce legislation that I had introduced this year and had to drop because of the COVID chaos, to legalize contingency management for primarily for meth addiction. As you all know, there's no real medical treatment for meth like there is for opioids. And contingency management, offering financial incentives to go into recovery, stay in recovery, has been, the VA has been using it for about 10 years and it's been very successful. We want to make it more broadly available. We are, I just announced legislation to end mandatory jail sentences for drug possession. California still has a set of situations where simple drug possession, not dealing, drug possession can mandate that you be incarcerated. The judge has no discretion, even if the judge thinks that you should be on probation or in a diversion program. And so we're going to try to get rid of that. And then we have a bill that we've announced to decriminalize psychedelics, which, as you know, we're increasingly aware that psychedelics, when used properly, can have significant medicinal and mental health benefits. And so Oregon recently decriminalized psychedelics, and I think we should do the same. Ultimately, we need to decriminalize all drug use and possession. It simply shouldn't be a crime, but we're at least starting with psychedelics.
Yeah, I'm surprised by those mandatory sentences. I thought we got rid of that. I thought we were done with that. Okay.
No, I mean, California was one of the worst offenders in the war on drugs and mass incarceration, starting in the late 70s, 80s, and 90s. We really went way overboard. We went from 8 state prisons in the late 70s to like 32 state prisons by the early 2000s, like a prison building spree. Exploded our prison population, and it's just had huge budgetary impacts. It's harmed communities. It hasn't really benefited us, and so much of that are drug-related offenses. And this particular mandatory jail time was passed in the mid 1980s, and it's still in the books.
I had no idea. Well, that was our actually last question. That was either one of mine or sent us. But is there anything else you in particular wanted to tell us about SB 855 or any other upcoming legislation that we should be aware of and what we can do? And
yeah, I mean, I think just globally, the war on drugs has been an abysmal failure. If you look at what I don't even have the numbers, but the amount of money that this country has spent on the war on drugs over the last 50, 60 years, it's just, it dwarfs like the war on the Iraq war or the Afghanistan. I mean, and it has failed. It has not stopped people from using drugs. Addiction, if anything, is worse now than it was, 50 years ago. So people are still using and getting addicted and dying. But we've just incarcerated an enormous number of people, disproportionately Black and brown people, and just thrown people in jail instead of giving them treatment, torn apart families, torn apart communities, and it's busted our budget in California and gotten us essentially nothing. So we're just overall trying to treat addiction as a health issue, and then trying to make sure that for addiction and any mental health issue, people can actually get treatment. Because we used to have the state hospitals and we warehoused people who did not need to be warehoused at all. And then we went to the opposite extreme where we said, okay, we're going to close the state hospitals, which was a good thing, but we went so far in the other direction that we didn't replace it with a community-based treatment with easy access, and that it's just caused a lot of problems. So we're trying to find that right balance.
Yeah, I think things are moving in the right direction. Obviously, this is one step in the correct direction. I think there's been more. Definitely, the stigma factor I feel like has significantly decreased over the past few years. But I understand that mass incarceration was for a period of time, unfortunately, what people thought might be the solution. And obviously, like you mentioned, it was disproportionately brown and Black mass incarceration. So thank you so much for your time today. I just want to thank everyone else as well. The senator brought up COVID in his earlier comments. I want to thank, all the frontline workers there. I know I have some family and friends right now dealing with, the medical system, and luckily some of them just got their first vaccine shots today, those frontline workers. So, my cousin Monty, an infectious disease specialist with Kaiser's, had a rough year, and to all the frontline workers, many of which are actually on this call, with this substance use disorder and mental health epidemic that has been exacerbated over this period. It's been a very difficult time, obviously dealing with both the rise in mental health and substance use disorder situations, and dealing with how to operate your businesses in this new environment with COVID. And obviously telehealth has been helpful in that regard, but it's not far from perfect. But again, thank you to everyone here. Thank you to the senator for taking the time. For those of you who didn't have your questions answered, please feel free to email info@zealie.com, and I can help in any way, do some research and get those questions answered for you. You can obviously visit the senator's website, which has a great deal of information on it about this. And I encourage everyone, as the senator said, to, especially the advocacy groups, come together and help, A, enforce this, and B, if there's any future changes, you want to be involved in that process and use that frontline information to benefit the legislation, so we can get the more increased access for mental health and substance use, which obviously is definitely needed, and the senator is on the front lines of that, getting that out there. So again, thank you so much for being here. We really appreciate your time. And to everyone else, thank you so much as well. All right.
Thank you so much. Have a wonderful holiday, everyone.